Aloha again. It's the traveling doctor, and I'm back. This is the Monday, March 30th daily update podcast for COVID-19. I am not going to be doing these every day just because a lot of people are asking. Uh, it is kind of exhausting to do these every day, so I think I'm going to start doing them more Monday, like today, and Thursday. I'll add on others if there's other really big news or I have some update, but I'm basically going to cut these down about twice a week, especially as I start doing telemedicine and other things. Again, I'm Dr. Albert Lin, NYU med school trained, Cedars-Sinai's internal medicine residency trained, and hospitalist here for 14 years in the state of Hawaii. So what's the update? Man, the news is changing so fast, and I had a lot of friends kind of overwhelmed because there's so much news, there's so much good news, there's so much bad news. It's hard to keep it all tracked. So this is to kind of put it all together. Really pay attention to it. And there's a lot of the testing front, even the vaccine and medication front. So I'll get to those in turn. I made a couple notes. So again, just so the COVID-19 initial test everyone was taking, nasopharyngeal test, had a bad sensitivity. A lot of false negatives. Again, a lot of false negatives. What does that mean? That means that 30% of the time you would technically have the disease, but you'd get a negative test. And it was just because of the way it was done, and it wasn't either because of the way it was done or because of the reagent or whatever. So people who were negative weren't always, or who were positive weren't always being told they were positive. And that's the test that everyone's been getting. As many you have TV, there are other tests that are coming on. I had another friend, by the way, my friend who got his test a week ago still hasn't gotten his results. He's been waiting 8 days, and he had a different test, an oral pharyngeal test, where you sort of swish and swat, like spit out. And I would guess that sensitivity and false negative rate is also pretty bad, or pretty high false negative rate. But on the news front, the big news has been the Abbott laboratory test. Now, what is the Abbott laboratory test? It's similar to the test that we're taking in that it is, again, a nasal pharyngeal swab. But it's got this crazy what they call point of care machine, where you can get the results within 5 to 15 minutes. So Stacy said 8 days, and he's kind of sick, and he's starting to wonder, So it doesn't help you take care of health and figure out what you're doing, and if someone's sick or not, if they can go back to work or not, if you take 8 to 12 days. Now, I got the test back in 4 days, and I consider myself lucky. Again, the Abbott test, same thing, nasal pharyngeal swab, and it's kind of like you put it in, like a great example of point of care machine is like when they swab your hands when you go through TSA and they make sure you don't have gunpowder, and they can test it and it gets cleared right away. That's a point of care service test. And so Abbott Laboratories has one, and they're going to be releasing it, they said. I think this week they're going to be making hundreds of thousands, if not more, and getting them to everyone. So again, I love that it goes on the same principle. And apparently if it's positive, you'll know within 15 minutes. You get it, and you stick in a reagent, and you stick it into one of those machines. And it can be done if, ideally, it would best be done at drive-through clinics, or drive-through testing sites, walk-in testing sites, and emergency rooms. Because that would help us tell people, do they need to go home and quarantine? Do they potentially need to be admitted? Do they need medicine? So that is the big one. And big thing, it's FDA approved. So this means the FDA has said this is a good thing. So that must mean, in my mind, the sensitivity is pretty good. And maybe there's a low false positive or false negative rate. Hopefully there's definitely a low false positive rate. That's not actually the test I'm as interested in. There's another test that a lot of people have been hearing of, and I know this because I've been reading or seeing some of the financial sites. There's a new test by a company called Henry Schein. Has anyone ever heard of this company? I never have. I've heard of Abbott. I've heard of, Gilead and Regeneron and, all these other, Pfizer and all these other companies. But Henry Schein, Schein, look this company up. They're being interviewed because they're having a crazy, not just instant test, they're having a antibody instant test. So the way it works is you get a finger prick. A finger prick, like if you know anyone who has diabetes and they test their blood glucose, and then they put it on and they get the test result back right away. There's this test that Henry Schein is making that's supposedly a finger prick test. And it doesn't just tell you if you're positive or negative by like the PCR test. It tells you IgM and IgG. And it's really weird. I looked at their thing. It's like a stick. It's like when you get a pregnancy stick, when you test if someone's pregnant. Not that I've ever seen that. But if you get one of those pregnancy tests, and then you like pee on it or whatever, it tells you positive or negative. And this will tell you IgM positive or negative and IgG positive or negative. And again, as you know from my last podcast, I think that's brilliant. And that is a true game changer for tests. Now, the problem with that test is it's not FDA approved. They had the boss of the company on CNBC, and they're talking, it's great and it'll be made available, but it is not technically FDA approved. So what does that mean? The FDA has probably said they've got to look at the research and see whether it's accurate or not, because it would suck. Like getting a fake, like a pregnancy test that isn't accurate. It sucks to think that you're pregnant when you're not, or it sucks to think you're not pregnant when you are. So the FDA has to look at this Henry Schein test. But obviously, Henry Schein, their stock went through the roof today. And Abbott Laboratories, their stock went through the roof for obvious reasons. And that's interesting. And I will talk about this later in terms of treatments. But another stock that went through the roof is Johnson & Johnson. And why? And this is a big news a lot of you probably heard about. Johnson & Johnson is saying they're working on a vaccine. And guess what? Boom. It will come to the world potentially by September. They're saying September, which is a lot earlier than most people, epidemiologist countries were thinking of. Now, that doesn't mean that even if it comes September that everyone can use it. I'll get to that later. But if it's really coming in September, that is a huge deal and a huge game changer for public health, for economy, for keeping first responders, doctors, nurses, EMTs, police officers healthy, and people most at risk, the comorbid conditions who aren't sick yet healthy. Now, again, I got to remind you, the vaccine will not really, as a way it's supposed to work, may not help people really, and it probably won't be used to help people who are sick already. If you're sick already, that kind of sucks both now and in the future if you don't get that vaccine. This is what we're trying to prevent by self-distancing at home. Okay, so again, that's about the Henry Schein IgM, IgG test. Again, it's not FDA approved, but as I've always said, the IgM, IgG antibody test will be the ultimate game changer. And again, a version of it is being used in the UK right now. So going back on tips, again, I told you avoid all like group areas, the gyms. I can't believe people are still going to gyms and having parties. And this is the big one I got to stress on, church. Church. Do not go to church. Again, as I mentioned last time, there have been Florida pastors and megachurch pastors and like Louisiana megachurch pastors, and they're still having 1,000 people come, and they're getting arrested, and they should get arrested. You know why? Because if any of their congregants get sick and die, I mean, as far as I understand, that is that's serious. I mean, I don't know if it's voluntary manslaughter, but at the very worst, it's reckless endangerment. And I mean, I understand people want to worship, but this is coming up on what do we got in less than a week? We've got Easter Sunday. As far as I know, most of, especially the Catholic cultures, Mexican, South American, and very Christian countries are going to go out in droves if this isn't hammered home enough. And I don't hear people talking about this. I don't hear the CDC talking about this. I don't hear, Trump and other world leaders talking about this. You should think ahead. What is logically going to be the next big thing? Like Mardi Gras got all of Louisiana sick. And traveling back and forth, and having concerts and big, family dinners and birthday parties and weddings. What was this all doing? This is making everyone sick. So think ahead. What is the next biggest thing? It has to be church. Church has to be shut down. And I don't mean religion has to be shut down. Shut the mega things down. Do it all virtually. Man, I understand that, churches need donations and offerings and these sorts of things. You can still do that. Set up GoFundMes and other things, but don't put people at risk. If you really care about people, if you really care about your family, if you really care about your own congregation and you're doing God's work, so to say, you should be canceling it now. They should be talking about this on the news now. And like Governor Cuomo should be talking about it. Trump should be talking about it. Every major leader, every state leader should be talking about it now. Why? Because it's too late if you talk about it in a week. Easter's over in a week. So you need to talk about it. And I'm telling you guys, so you tell all your friends and family and maybe even yourselves that you should not be going to church. Do not go to church. No amount of mask wearing, even if you're N95s or whatever, is going to help you if you're that close in 1,000 people or something. It's just common sense. And it sounds like common sense, but no one's doing it, okay? And I agree to Stacy, and, I'm sorry to say this, but this, I would personally report churches that do this stuff. I'm not telling people what to do, but I think this is what I would say. God wants you to be safe. God wants you to be safe, and he doesn't want you to put yourself in danger that way. That's what I would think. That's what I would think that any, someone and, that cares about you would want you to do. So this is my number one advice for right now, and I'll reiterate it on later podcasts, okay? So let me go into other things. Again, I mentioned about the symptomatic meds, the Tylenol, the Coldies, the Hall's lozenges, guaifenesin DM. I did a run through because I had to go to, shop and grab some last minute groceries, which I did very quick in a mask and was clean. And I'm seeing that finally some stuff is back on the shelves. Tylenol is back on the shelves. Guaifenesin DM is back on the shelves, at least some of the shelves I'm seeing. I still can't find any zinc at all. And as all you know, there is no surgical mask N95s. It's really hard. Any ones that I've seen have been people offering to sell them through a supplier or make them or donate them. And that's great that that's happening, but I don't know that can be a long-term solution. Obviously, we need big companies to do it. Even the distilleries that are making hand sanitizer, they need donation for rubbing out or other alcohol because they're running out of stuff. The ones here in Hawaii are running out of supply to make the hand sanitizer. So, everyone's searching for the stuff online. Hand sanitizer, N95, surgical mask. Again, the stuff I ordered like more than 10 days ago still has not come to me. And I don't think it will ever come to me. I don't need donations now because I'm not working for a while, but I will let you know if I need some. And again, there are a lot of crowd share sites. Neil says, I went to Church's Chicken. Does that count? Hey, Neil, if you did it all safe, that's fine. 6 feet away. Even the places I'm going to. I went to Yama's Fish Market to get a lunch plate and some poke, and there was a 6-foot line in front of me and behind me. So everyone's doing that stuff. And I've seen in Whole Foods and a lot of these stores, as some of you mentioned, they're still not doing it at Walmart. They're still not doing it at Don Quixote, some of these other ones. But, and what I'm personally doing is I'm self-checking out. Again, I'd rather me check out my stuff and know that it's just me touching everything. And that goes into, again, going back home and decontaminating it and stuff I will get into. So that other advice I give you is set up a decontamination route at your place. For me, it's immediately my entryway at home. Again, I get butt naked, get everything off. I dump everything that I carried out the door or brought back in right there. I have a decontamination bathroom that I go shower in. I have an area to wipe stuff down. I throw my clothes and even my plastic bags, everything into my laundry washing machine right away. That is what I do. I wipe down boxes of spaghetti and other stuff that I have. And I use my bathroom to do that, and then I transfer stuff after everything else is clean. I leave my shoes at the door. I bought online a new pair of shoes that I'm just going to leave, or I'm going to use my old pair of shoes to just leave at the hospital and use my pair of shoes only for coming in and out of my place that's not the hospital. Things like that. You're going to have to wash your clothes more. I mean, this is just common sense. Unfortunately, we got to waste a little water. I think Mother Earth will forgive us that part for now, okay? Stephen says, safe way. People are not great at doing it. And again, that's a problem with produce. People are palming stuff. I personally use a plastic bag, those plastic bags that they have, and I use that if I need to touch stuff, and I look carefully, and I just ideally grab the thing I need, but I try not to do it that much, maybe frozen vegetables at some level may be a little better at some time if you don't need fresh stuff, but I understand Trader Joe's, Whole Foods, organic, all this stuff. A lot of you want to eat healthy, and it is hard. Obviously, wash produce very carefully, multiple times. I mean, it's hard to like soap it down, but you know, especially if you're cooking it very hot and you wash stuff thoroughly and you wipe down the boxes of stuff you can, that would be good at least, you know. But again, you know, people are not good at social distancing. I heard a story, really sad story, in a hospital. Some poor older lady didn't really know what was going on. She was 89 years old in New York, didn't social distance well, and a, let's say, mentally deranged criminal guy who was in the hospital for seizures saw her near him, hit her in the head, knocked her down, and she died because she didn't social distance. I'm not going to say that's going to happen to you or you should do that to anyone, but I'm just telling you, people are taking it seriously. That guy overdid it. Ideally, you know, you shouldn't be doing stuff like that, but it is happening that people are getting very upset. You know, I should mention some other stuff. Again, you know, there is a lot of Asian American hate crime stuff that's gone. I mean, it sucks for me. I'm Asian American. I'm a doctor trying to help people. It doesn't happen as much in places like, let's say, China, where everyone is Asian, or Korea, where everyone is Asian, and they've done a better job. And in Hawaii, where, again, like 80% of us is some part Asian. But it's starting to happen in other places. So, you know, you got to be careful. I hate to say this to my fellow Asians out there, of which a lot of friends are Asian, watch out a little bit. Potentially don't bring your family out if they don't need to be out, you know. Be careful. It sucks I have to say this, and I worry about after this is all done, how Asians will be treated when we go to travel. Like, I'm thinking, like, before I used to hate, or not hate, but I used to, you know, being American wasn't a great thing, but I can imagine going to Italy or Europe or other place after this, and I'm going to be talking loud English and American English and saying I'm American, and, you know, as some of you know, I've been targeted for anti-Asian racism in other countries, you know, so it's not a joke, and this is something to be ashamed if anything happened. I do think there are ways to mitigate this. If you don't go out in public, it's not going to happen, obviously. If you don't expose yourself or put yourself in situations, it sucks that we have to do this as Asians, but it may be something you need to do, okay? So, yeah, you shouldn't hurt people, Stefan, yeah. Albert 2020, yeah. And, you know, obviously, I hope that doesn't happen that much. So, another thing going into, besides self-quarantining, you know, again, I mean, it is really problematic. A lot of healthcare professionals are coming home and living in tents in their garage or living in separate bedrooms and not able to touch their family or kids or whatever. I'm preparing, kind of like Chinese doctors, that if it gets really bad, I may sleep at the damn hospital and just order takeout and sleep and that kind of thing, you know? And that's especially if I'm working all with COVID-19 patients. Now, again, Hawaii's been very good lately, but we're coming up on our peak. Just to give you a little preview, from what I understand, most states besides New York have not hit their peak. So it's not like New York's getting killed and everyone else is fine and we should all go back to celebrating. And most are saying that the peak is coming up April 15th, ironically tax day, or, you know, before it's postponed. So a lot of states, including Hawaii, are going to start seeing an uptick in not just cases, but hospitalized cases by April 15th. And it will be really bad for most of us in America, in all the different states, by the end of April. In other words, everything we've gone through so far is just preparation. So if you're stressed, if you're worried, oh, we have too many cases, this is nothing, and it'll be a drop in the bucket, and it may be double or triple or more, very likely, before we get to April, end of April. You know, I'm expecting Hawaii to be hitting the high hundreds soon, by mid-April. And obviously by that point, we'll have some deaths. We haven't had some deaths yet. Another thing that, again, the CDC and FDA, a lot of people have been saying, you know, in other countries, Stanley said, back to mainland. So no one is going to other countries. I'm not saying going to other countries, Stanley. I'm saying, like, after this is done, if people are traveling after, you know, COVID-19, there will be a lot of anti-Asian racism still. So again, to the point, a lot of you have said, oh, I'm getting offers by people in China, I know, suppliers that give people, you know, masks, and you know, they're only asking for extra shipping and whatever. I have to be cautious about that. There are going to be a lot of scams. I'm predicting the feds, the state, hospitals, and even you will be scammed out of money because you're buying stuff from people that you don't necessarily trust. The FDA and the CDC had no are setting up a page of people that are fake, and most of these fake sites are, guess where? From China. There's, these are not real masks, so you got to watch out for that. Okay, I'll add a couple of questions. It says, I hope I move. Yeah, maybe move back, but Grace, I think it may not until the summer or May or June or beyond that before the travel restrictions even remotely get lifted. And even then, you may still be in quarantine. Brian, yeah, is no hazard pay. Doctors don't get hazard pay. Nurses don't get hazard pay. I haven't heard about this. I've heard rumors that Trump may announce it as a new stimulus plan, that first responders will be getting like a hazard pay bonus, separate from the $1,200 stimulus check, that only, again, I think families under make under 75,000 or families under 150,000 will. I heard hazard pay may be put into the next stimulus bill. Congress is out of session until April 20th, so I wouldn't expect anything before then. But ideally, maybe I will work for my same salary. It's not about that, but a lot of us are going to get sick. A lot of doctors and nurses are going to get sick. 60 doctors have died in Italy. That is a fact, Stacy also mentioned because people are not. See, the numbers, I don't know what the policy is. As far as I understand, there are reinfections going on. I don't know what you mean by recovery numbers, but a lot of more secondary bump is happening of infections because people are getting flown back. All the countries that had their citizens and states that had people all over the world, they're coming back and they're bringing the disease with them again. And people are getting a little lazy about it, especially countries like again, Singapore, South Korea, China, that thought maybe they avoided stuff, Kyle, that's incorrect. Why one death that was falsely positive? That was a false positive. They tested a guy after he died, and they thought he had COVID-19. And I'll go into that later, because that explains some of the numbers from Italy and other places. For example, Italy tested people who died of anything, and if they had COVID-19, they said that was a COVID-19 death. Germany isn't doing that, so their numbers are low. So I've been talking about this. Why are the Italy numbers so high with the mortality rate? Why are Germany numbers so low? It has to do with who you test, right? If you don't test asymptomatic people, your denominator or total number of people is very low. So like Italy may not have done that. China definitely didn't do that. So don't believe the China numbers, and we're maybe in the middle of doing that. South Korea has been taking everyone, so their denominator is really big. But, and it also goes to, do you test people? Do you test, everyone that's sick in the hospital, especially people who are sick and especially people who died? Obviously, if you test people who died, their chances of having COVID-19 may be higher. But then that brings a very interesting medical dilemma. Did they die of COVID-19, or did they die because of all their other sicknesses? Their kidney failure, their other pneumonias, their heart failure, their COPD, their other diseases. This is debatable. This is very, very hard. And this is what some of the people say, oh, we're worrying about this too much. It's like the flu. Everyone would have died. I mean, again, those people are wrong, because we're hitting a peak so high and we aren't exposed to this before. No vaccine, no real good treatments yet. So I want to get, Todd, is New York, I think New York is not at its peak. It's ahead of other states. So I think the peak is still to come for New York, but it is ahead of other states in terms of but as Governor Cuomo said, New York is a canary in a coal mine. They are the first to get hit, and hit hard. So we will expect to see the uptrend in every other state first, but I also expect New York to recover first. Why? Because we're treating it the most serious right now there. 200 dead numbers concerned. Greg, that is too far to say. I say 200K is a very realistic number, and to put it in perspective, again, 100 to 200K dead sounds like a lot, and it is a lot. But your typical flu season is 15K to 60K. So essentially, you're saying this is going to be triple that mortality rate of a bad flu season, triple mortality rate in a whole year. Now, they're saying 200K, but we're going to tomorrow. I think when they're mentioning these numbers, they're saying of COVID-19 in a year and a half until we get this vaccine, or even afterwards, how many people are going to die. I think 200K is a very real number. It may be a lowball number, or it may be too high of a number if we do a better job. I think it's a perfect number to say generally, but again, I'm not an epidemiologist. I have to trust what the government is saying on some level. Anthony says, I'm supposed to pick up a new puppy in Iowa, and dude, Anthony, if you want to do it, I mean, I think it will help you, maybe, but I can't say don't do it. I just think it may be a bad idea if you're getting exposed too much. I mean, the only way I would do it would be drive straight there without, stop, or at least taking very, very, cautious whatever breaks and away from people, and then going right back into your car. I mean, obviously you got to interact with someone to pick up the dog. I'm just saying any unnecessary travel is a really bad idea, man, for everybody. Anyone has, I could use other things I could go out to in Hawaii. I mean, I can still technically surf. I haven't done it yet. I heard California is ticketing surfers in Santa Monica. Hawaii is not, okay? Yeah, I already mentioned that in my earlier days doing human trials, COVID-19 vaccine, starting it in September, maybe, yeah, January. I don't know. But again, what is that? That's 8 months away for us. So we got to maybe self-isolate and social distance for another couple of months, So a lot of people ask me, do I think it's over in April? Do I think it's over in May? What do you mean by do I think it's over? I think maybe the biggest disaster part may be more controlled. And again, we're going to get very social distancing the entire of the year, I think. I think we'll do some level of social distancing unless they find a medication that is really good. And I'm going to get into that. Yeah, Brian, you're right. One cop and one fireman has risk from too. Okay, so let me go into some medications because I know everyone's been asking about the medications. Oh wait, I want to address some other stuff. So everyone's been saying, oh, 3D printing is going to be some things so we can do multiple ventilators and stuff. And again, there are a lot of interesting ideas, crowdsourced 3D printed total ventilators. But again, you have to understand a lot of hospitals are not allowing people to use these for liability reasons. I can't just bring something in and use it because if it doesn't work right or whatever and the patient dies or gets sicker or something else, then it's on me. I get sued and I will never work again. And, it's a liability thing. So everyone, it's very creative that people are making even masks and making, these 3D printed whatever things. But we're going to have to convince administration in each and every single hospital or have a state law or federal law or mandate or state mandate that we're allowed to use these specific things. We can't just bring them in because, again, it's a huge liability thing. There are lawyers, again, already asking patients who haven't been given the right treatment and meds and the right anything, complain to these lawyers and you'll be able to sue the doctors and this is all done. Which brings me to my next point that I think, again, I'll reiterate this. We need protection. The healthcare workers and nurses and doctors, every state, federally, they should be passing a COVID-19 liability thing. And I'll tell you why this is a thing that's important. Because there are hospitals, as some of you guys may have heard, that are initiating what we call ventilator protocol. You'd heard about death before. Or train the National Guard to use manual ventilators and shift. Yeah, that would be great. Stephan, there are people that can learn how to use ventilators on a basic level, but I'll tell you, the decision to take someone off or take someone on, put someone on or take someone off a ventilator, it's more an art form and figuring out what to do. Using a ventilator, you can learn some of the basics and it's decently, but again, it's a last-ditch effort. But again, I think you need to the liability away from anyone that's being trained. These doctors that are coming out of retirement that are dermatologists who you might be getting treated by a dermatologist or anyone else that hasn't really treated lung disease or anything. Yeah, Todd. Yeah, they've been building ventilators. So again, federal government has been initiating some more demands to actual companies, mandating them by this federal Defense Production Act, which I think hasn't been used since like World War II or the Korean War or something, to do this. So now Trump is actually finally making companies do it. And again, you have to be smart. You can't make an auto worker or auto company make masks, and you can't make a distillery make ventilators. You need a distillery to make hand sanitizer and a auto manufacturer to make ventilators. So you have to adjust for some of this. So again, let me go into some of the medication, and this is the part of I guess podcast everyone's really interested in medicine. So let me start with the big one again, hydroxychloroquine. So Big news, the FDA has, or maybe not the FDA, I'm sorry, the CDC has recommended guidelines. And again, you know my love-hate relationship with the CDC. I think they act too cautiously, and I think sometimes they act too late. And sometimes I think they give bad recommendations, like for PPE, but I'll get into that. But the CDC has recommended now, officially, that can use hydroxychloroquine and azithromycin if, and only if, you are a hospitalized patient. So that means not if you're just kind of sick and at home. You shouldn't be hoarding it to self-treat, and no doctor should be writing it for you. So only if you're in the hospital, like a moderately sick with pneumonia or on a ventilator, or if you're a first responder. In other words, an emergency doctor. And there's no cutting the lines. Who's a first responder? That would be ER doctors, regular doctors, nurses, EMTs, firefighters, police officers. It's obvious whether you're a first responder or not. You know, unfortunately, and I hate to say this, if you're a father or mother who's sick and has kids and grandfathers at home, you are not a first responder. I know that sucks. Even if you're a caretaker, you may not be a first responder, although I think there's a debate about that. If you're a caretaker and run a care home, would consider you high risk. So these are recommendations now CDC has put out for the first time that hydroxychloroquine can be used, and not that it even totally works, but that there's enough evidence that the risks are outweighed by the benefits, okay? The risks are outweighed by the benefits. What does that mean? The major risk for hydroxychloroquine, by the way, with azithromycin is a heart risk. QT prolongation. What does that mean? Essentially, you mess up the rhythm of the heart, and the heart can stop on you if you take this combination of drugs alone. A lot of people don't know this, but Z-Pak alone and azithromycin alone was having warnings about this just without the hydroxychloroquine. And there was a debate about whether you should be giving Z-Pak out that much. And this has come to the forefront because now they're recommending it with hydroxychloroquine for compassionate use or for very sick patients. I will tell you more about the data. The data is still not great. I'll be honest. The new study came out from the French group, again, this French group that first came out, and they had 80 people studied, not 40 people. And that study showed, hey, guess what? It still works. But again, not a lot of people are convinced because I think it only still looked at in vitro, the numbers of virus, not for if these people actually did well after. Did they survive? Did they have fewer symptoms? Did they whatever? This wasn't mentioned as far as I know. So that's in vitro results. That's like saying a drug works in the petri dish in a lab. It doesn't work for the rat. It doesn't work for the human. So I think the evidence still has to be proven. And one bad sign, I'll tell you, China did a study about hydroxychloroquine, and they showed no difference in vivo. They studied 30 patients that got hydroxychloroquine and 30 patients that didn't. And 14 people did better with the hydroxychloroquine, and 13 people did better without it. Or by better, I mean I think they survived. I think they tested just sick people. So the debate would be, well, maybe hydroxychloroquine doesn't work for really sick people, but it could work for less sick people or even asymptomatic people. These are all studies, people. This is why you cannot just throw drugs at everybody because there are risks. Your heart could stop. If you have heart problems, maybe hydroxychloroquine and azithromycin is no good for you. I say generally the risks may outweigh the benefits, but you gotta let some people guide this. The doctors guide it. You should not be hoarding it just at home because guess what? Again, they won't be available for the hospital once we hit our New York peak and 1,000 people in the hospital that may benefit from it. And they don't have not 1,000 pills, but they'll need like 10,000 pills, or more to totally treat these people. So, and people brought up, this is a generic drug, okay? It's Plaquenil, and it is used for rheumatoid arthritis, lupus, but the generic is hydroxychloroquine. They have a shortage now, like the shortage of toilet paper, but they should be able to make millions of these layers. So if it works, it's great. Works, it's great. Stefan, yeah, the recommendation is to take hydroxychloroquine and azithromycin together. That is what, I debate that too. I think that's a higher risk of QT prolongation. I think technically there may be a role for just hydroxychloroquine alone later. But again, this is study, and I told you the CDC is playing catch up. The CDC still doesn't recommend, by the way, you use masks everywhere in public, but guess who does recommend that? The World Health Organization. So do you see the neck? The World Health Organization is saying you should be wearing masks when you go out. The CDC is saying you don't do that. Who do you listen to? The reason the CDC is saying don't do it is because they know there'll be a run on the masks. It's hard enough to get masks already, and the states and the feds can't get enough of these masks. So it's not a problem, it's no problem. I mean, it's going to be a problem. It is a big problem if the World Health Organization is saying we should. I think every single one of us should be wearing a mask going outdoors. Why? Because this is an asymptomatically spread disease. I'm not, Stephen Fauci. I'm not whatever, but I think everyone should be wearing it because you may be getting sick later and you may be breathing it out. Even if you're, in public and you get close to 10 feet within someone and cough, you may be depositing it on that ATM you're waiting in line for. You may be depositing on the gas handle. That's another thing you guys should be wiping down. Gas handles. When you go out to go get gas, wipe down those gas handles because, I think the CDC has to be starting to recommend this, and they probably will once there's more supply of surgical masks. But they can't do it because the CDC recommendations will have to be followed by the hospitals. And guess what? The hospitals don't have enough masks. They don't have enough surgical masks still. So, Roger, COVID patients. Roger, I've addressed this in multiple podcasts. You should look back at that. The short answer is that recommendation has been taken away. That was a false recommendation that has been taken away now. I mean, I still would prefer using acetaminophen than ibuprofen, but that is something that's just based on stomach problems and kidney issues as related to other things. Herbs, echinacea, dude, any of this herbal stuff, only homeopathic thing I can recommend is zinc for now. I've seen zero evidence except anecdotal evidence for anything else that is homeopathic. Vitamin C, vitamin D, anything. Essential oils, taking baths, hot green tea, hot water, ginkgo biloba, any of this stuff. I haven't heard any evidence for any of that. And Todd, yes, there will eventually be a home test for everyone to take. I did mention this already. The home test, COVID and Everlywell, they were so popular that they sold out immediately. So if you go on the websites, the only persons who were able to order them were home, like doctors who are ordering it for their own personal patients. You can't order them yet. And again, I don't know how sensitive they are. And they're not FDA, or certainly one is FDA approved. That is FDA approved. So there are tests that will eventually be available. Again, there's a shortage. Everyone's running for the tests. Everyone hydroxychloroquine. Everyone's running for everything. You guys have got to calm down a little bit and look at the evidence. That's what I'm doing. I have one bag of zinc tablets, and I've got one bag of cough drops. That's all I got, guys. And acetaminophen. Okay, that's all I got. I am not holding on hydroxychloroquine. I am not holding on to a bunch of other stuff. I'm the doctor, so, I think this is how you treat stuff, so they're not supplies. Because if I said, hey, by the way, there is a, if you go and wear, condoms that are peppermint flavored, you're not going to get COVID-19, and everyone makes a run for peppermint flavored condoms. Like, this is ridiculous. This is what you guys are doing right now, so saline nose spray, no, absolute garbage, Todd. That won't do anything. Okay, so Xanax, yeah, Stefan, I recommend Xanax. I recommend ways to calm down. But anyway, I want to go into another medication that has really good potential. And thank you, Egypt, and from telling me this medication that has real big potential is being studied. It's called BCG. What is BCG? BCG is a drug that everyone has seen. People from foreign countries. If you've seen, they've had this scar. It looks like a circle scar, and people have been getting that. People have been getting that in certain countries. And what is that used for? That's an immune boosting vaccine that countries with high tuberculosis rates have been getting. And what they've seen, interestingly, is that if you overlay the map of the countries where you get this BCG, in other words, friends from countries that have this oval-like thing when you're a kid that leaves a scar, unfortunately, that those countries that have that have very low rates of COVID-19. If you overlay the COVID-19 international global map with that. Now, is that just coincidental? Totally, it could be. But it's enough a possibility that 4 countries are studying it now. Australia, Netherlands, the UK, and Germany are all studying BCG as a treatment, not a vaccine. And that would be huge. It would be another game changer because it's like hydroxychloroquine. It's a very old medication that has been around, and we have tons of. And again, now I know everyone's looking up BCG and running to their primary care doctor or pharmacist to get it. You cannot get it like that. Your typical primary care doctor in America doesn't have it. The way it's supposed to work is that it's supposed to ideally boost the immune system. So the theory is that it boosts the immune system, and those people who have it may have a better ability to fight off infections and upper respiratory tract infections. Now, I caution that this is not studied for real. And if that were true, then you would think that people from those countries should also not have as many colds, not have as much flu, right? Because got it, they should also be protected against that. That's why I'm worried about this recommendation. My bet would be that maybe there's not really any evidence, but there's enough evidence that in Australia, Netherlands, Germany, and UK, they are giving this to volunteers. They're giving this to doctors and first responders to see what? To see if they have lower rates of getting sick later. So this is an interesting medication. I'm telling you this now. You've heard it here first. Traveling doctors telling you first that BCG will be another medication that Trump's going to talk about, that you'll read in the news within a week. You're going to read about this. And this is, it may be nothing, but it may be everything too. And that goes into the result about you take a bunch of vitamins. There's no harm in necessarily taking them, right? Some of them, like a multivitamin, vitamin C, vitamin whatever. But again, some of these vitamins, like ginkgo biloba and other things, they interfere with other medicines. So if you just give them to your grandfather or grandmother that's taking, let's say, 10 different medicines, some of her other medicines may not work. Some of them may even poison them. So if you're a healthy person and you just want to take vitamins and supplements, that may work for you, but never really know. Maybe you'll still get sick. Maybe you won't get sick, but you can't say it's from that. So it won't hurt, but I'm saying you just shouldn't take 300 of them and spend 1,000 because you think that will avoid you getting sick from COVID. So again, yeah, Alfred, I saw that. That's written by a Japanese guy. I've read that exact article. It's written by a Japanese guy who is an investor. He's not a doctor. There have been studies done. The study I read was from a 2011 Indonesian medical journal that said BCG helped prevent upper respiratory tract infections. Not exactly the New England Journal of Medicine. Do you see what I mean? Everyone is grasping for straws right now, including the medical community. So the problem is that you have to be cautious. Just because a medical journal and one study written 10 years ago by one Indonesian or French doctor or whatever in vitro working on mice or working with his kids doesn't make it right. I mean, I know this because I know how to read studies. Most people don't know how to read studies. I'm not saying I'm the only one. Everyone who logically reads the study should be able to see what the problem is. The numbers are too low in the study. They don't use it on human beings. It hasn't been randomized, double-blinded. There's no placebo involved. It was done, poorly, or there's a lot of bias. The doctor who was talking about this one drug, like Kaletra or something, works for Regeneron. Again, so let me talk about some of the other drugs. Unfortunately, there's not a lot of evidence still, and there were studies that show Kaletra from Regeneron does not work well. So not to say that it won't maybe be proven, but another one from Roche, Actemra, is also being studied. Gilead is still restudying Remdesivir. And again, Remdesivir and hydroxychloroquine and azithromycin are part of that big solidarity trial where clinicians are able to register people for a big World Health Organization trial. Google this, the World Health Organization Solidarity Trial. Started about, I think, 3 or 4 days ago. First patient signed up in Norway, okay? And again, I think the ultimate thing will be plasma antibodies or a real vaccine. That will be the main thing. That will be the main thing that we need. Plasma drawn. Oh, I heard that they're actually doing this, and I forget where, if it's China or somewhere, that they're taking the plasma out and giving it, the antibodies, to somebody to see if it helps them. And it may even be happening here on a case-by-case basis. Again, this is not something you're going to be able to walk into Walgreens and get plasma antibodies from somebody. Again, the vaccine is still looking at 8 months away, okay? They're going to start stuff in September, and maybe it'll be ready by January. But what? That's still 8 months away. So work on that social distancing. If you're bad right now, you got plenty of time to still do it. So again, I'm going to go into a little bit more of a global update now. This is sort of the current events section of the podcast. Some of you know I talk about Hawaii, the US, and then internationally. So again, as I mentioned, there have been predicted about 200,000 deaths from this. And again, in a typical flu season, you get 15 to 60,000 deaths. Okay, 15,000 to 60,000 deaths. So we are going to get a lot more. The problem is again, it's hard to differentiate. A lot of these people truly would maybe have been dying anyway. A lot of these people very likely would have been dying anyway. And again, it depends how you test them. If you test them just when they died, and then they died of something else, and you test them, they happen to be COVID-19, well, then who can say whether they died of COVID-19 or they died of something else? This is going to be the dilemma from a statistician's or epidemiological standpoint, is how do you count those deaths? Are those really COVID-19 deaths just because they had COVID-19? I think you have to count them as COVID-19 deaths. If they are positive in COVID-19, you can't say they didn't die of it. So you're going to have to say they died of it if you tested them. That's what's happening in Italy. So that's why their numbers are very, very high. I think the important curve to look out for, again, for everyone in the next 12 to 18 months is, again, this, we have this, big peak and then the multiple little peaks. You got to look at population adjusted growth rate, okay? Population adjusted new cases, ideally, not just new cases. Because if you see the new cases, it's a scary line. It just looks like this. And at some point, it'll be like China and Korea and curve off like that, right? That's what you're going to be seeing. That's what the only curves that most people are looking at. You want to see the active cases population adjusted. It should start looking more like this, and it'll go down. That's what you want to look at. So when you look at this, we're looking at that peak mid-April for most of the rest of America, besides New York. We want to see this and then go down. Or we want to even see lower than that, like this, and go down. That's what we want to see. Those are the curves we want. The population adjusted active cases curve, okay? And I do have a link on that I can provide later. Alfred said it's every year like the flu even after we develop vaccine. Alfred, it will. Because there's been coronavirus before, so it will mutate. There will be a coronavirus 20 or a COVID-20. It won't be as lethal, hopefully, and it may just be like a normal coronavirus. Like I've had patients in the hospital and they get sick, but it's just normal coronavirus. So it will automatically mutate, but the initial medical stuff I'm seeing is that the mutation is not that bad. There are maybe some strains, slight differences, but it's not enough that like suddenly we have to investigate new drugs. Suddenly we have new vaccines and like now we're back to square one. That hasn't been happening, so that's also lining for COVID-19. It's not mutating right now, but will it mutate later and come back as COVID-20? 100%. And that's why we got to get good at social distancing now, because not only are we going to maybe have to work on the curve for the vaccine for COVID-19, but maybe for COVID-20. Again, I would assume that once we have a vaccine for COVID-19, the COVID-20 vaccine next year or the end of this year will be easier to develop and work on, That is my bet, because you cannot change it that much. It can mutate a little bit with the protein, but it cannot mutate that much. And that goes into some of the other medications. Oh, from an immunological standpoint, that's one of the things why they're saying ACE inhibitors or, lisinopril and losartan, these medications were maybe dangerous. And again, they've walked back on that recommendation like ibuprofen, because the ACE inhibitor is supposedly, the ACE a receptor is what the virus attaches on a lot of our cells, and that's how it gets the lungs so sick. So that was one of the reasons why. So immunologically, a little nerdy, that's why ACE inhibitors and ARBs or angiotensin receptor blockers were at one point being seen as maybe this isn't good to still be on. Now they're recommending still keep people on it generally, like ibuprofen. They've walked back that advice, and this is the CDC again saying this stuff. So oh yeah, so Steph, yeah, so some people are testing positive for COVID-19. I've read that too. So again, it's hard, but they may be, so I don't see people as asymptomatic carriers. People that recovered, I almost would consider them, you have to consider them as asymptomatic carriers, like if they had never recovered originally to begin with, And it's hard. Do you tell those people to stay home forever or until they test negative? It may be hard. I think that goes back to IgG test, or sorry, the IgM IgG antibody test. That will tell you how to treat people and whether they can go out and work or not. Stacy, it's not that they didn't get a vaccine for coronavirus. It was that they had no incentive to make a vaccine for the coronavirus before. The coronavirus caused a common cold. There's not a lot of money in treating specifically the common cold that way with a vaccine if it's not life-threatening. So as far as I know, they have never really tried on a mass scale to make coronavirus vaccine. That's why we don't have one before. And even if we had one, maybe we'd get this one quicker for COVID-19, but they just didn't do one. Again, now when they get one, which I'm very sure they get one, then it'll be better for COVID-20, COVID-21, COVID-22, blah, 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 blah. We will be better prepared. So we're behind the ball again. World Health Organization, people could have seen this coming. Maybe we need a vaccine for paramyxovirus, for all the other ones, for rhinovirus, for other ones that cause problems. But we don't. We don't have vaccines for all of the multiple viruses that cause cold. And that's like 20 viruses. You cannot make 20 different vaccines. The amount of money and equipment that would cost just for a year to treat the cold isn't worth it for people to get it. It is for COVID-19 because people are dying, and this is a really strong one. So to answer your question, they haven't tried before because it hasn't been this serious before, okay? So, yeah, John, I asked about the sort of ventilator protocol. Todd, Bill Gates, I don't know what he's doing yet. I know that he's directing a lot of donation resources. That's what I've heard. So let me go into Hawaii right now, as opposed to the general flattening the curve. Hawaii, where we're at right now, 201 cases, majority on Oahu. We still have 0 deaths right now. That's good. We still have 0 deaths. The one death was walked back. It was not a real death. We only have 12 people who have been hospitalized for this. And of those 12 people, half of those are in the ICU, which means they're probably intubated. So we have 6 people in the ICU in Hawaii. They announced today, Governor Ige, all inter-island travel is undergoing quarantining and 14-day quarantine, same way that any travelers come to Hawaii. More citations are being given out. People are getting tickets for walking through park right now while walking their dog. We still expect our peak mid-April, April 15th, like tax day. People are still closed in terms of restaurants and except for takeout. The essential work, again, healthcare infrastructure, critical operations like plumbing, water supply, grocery stores, media, education, banks. Again, this is a lot of people, including airlines, are allowed. Oh, going on airlines, there's a massive drop in Hawaii numbers. Yesterday, for example, only 150 people flew into Hawaii. To put in comparison, more than 220 people came in that were airplane workers, flight attendants, pilots. So in other words, more airplane flight attendants and pilots and flight crew came in the planes than all the visitors combined. So we are dropping it tremendously, more than 95% drop. That's better than the rest of some of the other countries and whatever. So Hawaii is doing well, and they're still, again, you're getting threatened by $5,000 / 1 year prison misdemeanors is how I understand it. It is leading, unfortunately, to some problems. Social distancing, their domestic violence is going up. So this is everywhere in the country, and that is really bad, I think, and sad, Test turnaround is getting better in Hawaii. Here, it's only doing 1 or 2 days, so I'm really sad. Some of my friends are waiting still 8 days, 9 days, 12 days for this test. They are researching arenas like Blaze events from coming in to be temporary shelters, And temporary shelters, I mean the same way these Mercy Navy ships are being used in California and New York. They are not supposed to be used to take all the COVID patients and put them away. I think these places may be used for overflow when someone is sick from something else and then they need to go somewhere else and be taken care of, like a nursing home, other things like that nature of another thing. Let's say they have a skin infection and that's it. They go to like Blaisdell Arena and the convention center and Jacob Javits Center, this stuff. And then we keep the hospitals just as the isolation area for just COVID-19 and everything else like that. So that's where I think it's going in Hawaii. Again, we still are banning anyone from beaches. They are being patrolled. I know people are going to some of the hidden smaller beaches. I'm not even going to mention which they are because I don't want people to go there. Hikes are crowded, I've heard. Even the hikes are being patrolled, and or maybe not patrolled, but again, they're very crowded. It's very hard to stay away 6 feet away from people on like Diamond Head hike or Cocoa Head hike. It's impossible to stay 6 feet away most of the time from some of these hikes. Again, you know, one thing I want to bring up, it's very, very scary for us in Hawaii. We are looking at this time where we're seeing how crappy it is with New York and how the doctors are dealing with stuff. And again, like last week, I took care of a very sick patient. I had to put a tube down him and vent him. And it's very scary to think about what else we would have to do and be in full protective gear, you know, and not sick ourselves, and have him cough in my face, and then that's it, I'm done, you know? One cough, and I could be done. It's very scary to think about, but I'm glad we have these dry runs as we think about what we need to do. That plastic box covering, even the ponchos that we've used. Some people are using ponchos, you know? Like clear ponchos. You drape a clear poncho around a patient and intubate through a clear poncho. So if you've seen a rain poncho, that's a very kind of a creative, cheap way. They go for $1 on Amazon. You could buy like 100 of them, $100 and 100 patients. Alfred, I already talked about that. Some people are coming back with it. And so if they're recovered, again, this is not the thing. I don't want to get the PCR test about the virus. I want the IgM. I can talk to me after that test comes. Right now, if they're still testing positive, I would treat them as an asymptomatic, potentially contagious person again. So unfortunately, there's not enough data to say, do they get sick a double time? That would be really scary if you get sick a double time and you're sicker the second time. I've heard zero evidence. I've only heard evidence that people are coming back positive after recovering from it. And that may mean that it's in you and around you. You may have the IgG to protect yourself against it, right? Okay, so that's Hawaii. I want to give a little bit more about a U.S. update. Now, U.S. update's a little scary, and I hate to be a little down about it, but I need to tell you the things I'm thinking, and that will happen. Telemedicine is getting bigger because healthcare systems are being overrun. And again, no one wants to take their kid or themselves to urgent care their doctor. So telemedicine is big. One of my nurse friends, Grace, who's watching out there, is doing it. And again, we're not getting paid that well for it, but that's a different issue. They're now paying. New York is suffering. Doctors or nurses are being offered $13,000. Nurses are being offered $13,000 a week. In other words, if they worked a month, they'd be getting paid $42,000, way more than doctors are. I would assume doctors are getting paid $20,000 to $25,000, way more than they normally get paid a week. Because New York is drowning. You've seen the refrigerator trucks. You've seen the hospitals overflowed. You know, they are desperate. They're calling doctors and nurses from every single state to come out. They're grabbing doctors out of retirement. Again, as I mentioned last podcast, I considered going because I have 12 days off of work. But I shouldn't be going because if I go, then I won't be available for Hawaii. Hawaii is going to get hit hard. So I will do telemedicine, and I wish I could go. In another time, if it's not so bad in Hawaii, I will actually think about going and take myself off the schedule here if it doesn't look that bad in Hawaii. I have considered doing that. So right now, I won't be able to go because if I go, not only do I risk the people in Hawaii getting sick from me, but I have to quarantine myself for 14 days again. Again, I think healthcare workers are exempt from that. I feel bad for New York. New York is suffering, and there's still like more than half the case in other podcasts. There's been a uptick in the other hot zones. Again, what are the other hot zones? New Orleans, Louisiana, Atlanta, Georgia, Detroit, Michigan, Miami, Florida. These are the bad ones. What is noticeably missing? Boston, San Francisco, LA. Now that's really surprising. Now why are we thinking that that's happened? San Francisco, if you remember, San Francisco, the first shelter in place in any major city in the US. I think that's not coincidental. So San Francisco and LA and California generally is not predicted to run out of hospital beds. They may start being short on some ventilator beds and some other stuff. It's still bad. But San Francisco, which is not as packed as New York, granted, and LA is really widespread out. And I think for the first time that helped because LA is so spread out and everyone's in what? They're all the time. We're not jam-packed like a New York City subway in LA. that has helped California avoid this mess, okay? And canceled a lot of different things. Unfortunately, they had the LA Marathon, but New Orleans, for example, had Mardi Gras. That New Orleans is ridiculously getting sick. As some of you have also remembered that I've mentioned, the southern states are going to get slammed. The southern states, Alabama, Louisiana, Arkansas, Mississippi. If you want to look at how bad I think they're going to get slammed, and they have mentioned Alabama, Louisiana, and Arkansas and Mississippi. A lot of people are going to die there. Why? Because there are a lot of really sick people. Their life expectancy is low. Look at life expectancy U.S. states. Google that and look at the map. Those are the states I think are going to have the worst problem with deaths. Because why? They have the sickest people. So when they catch COVID-19, they're not likely going to recover. They're going to need to be intubated. And as you've heard me mention, when you're intubated, only, again, like 10% of people get off. I need more of these numbers for the next podcast. But that's sad that only 90% of people who get intubated may die, right? That's a 9 out of 10 chance that once you get intubated, you may never come off. Maybe people will, maybe whatever. But again, those are early numbers, so I don't want to scare you too much on that, okay? Stacy, Virginia has more ventilators and hospital beds. That's a weird because again, you can have ventilators, but you can't just put someone on a ventilator at home if no one can manage it. And unless they have a private doctor or a respiratory therapist relative. That's an interesting problem to have, you know. I'd rather have that. If that's the case, then technically if Virginia's not doing so bad, they may want to donate some of those ventilators to another state, like Georgia that's nearby, or Louisiana, or Florida that may need it. Now, not right now because they may need it. You never know. So again, as I mentioned, the Navy boats have come not just to New York, but to California. The Mercy boat, I think, is in New York. I forget which one is in LA. And again, that's to unburden hospitals for sick non-COVID-19 patients, okay? So they are doing well. Again, as I mentioned in the last podcast, the first one infant died. One infant died in Chicago. And everyone's freaking out. Oh God, you know, the baby died. And it is very sad, but we don't know anything about this infant and this baby. The infant could have had a lot of problems. I mean, the infant could have had cancer for all we know, or something else. And there may be other reasons why this infant died. We don't know. We shouldn't know. It's the family's private thing. But I caution against reading into too much that the infant died and that now we have a mutant strain that's going to kill all our infants. I mean, generally, I would still put in and your child. They shouldn't be getting out of the house generally. But, you know, that is a sad news out of Chicago, but I wouldn't read too much into it. Again, I mentioned the Miami, Louisiana pastor that are still doing these things, and they arrested one Miami pastor minister for doing this, and he should be arrested because, again, that's reckless endangerment at the very least. Again, I'm still noting that lower states, the smaller states are doing, yeah, John, Grace, a second Navy hospital. Okay, that's good because I heard there's only one going to in San Diego and they went to LA. But if there's another one, maybe California needs one for San Francisco and one for LA. Who knows? The bottom 10 states, the least populated states, the more geographically isolated ones. Again, the Hawaii, the North Dakota, the South Dakota, the Nebraskas, the Puerto Ricos, the Guams, you know, the ones that are really separated are doing much better. And one thing I mentioned about Hawaii, we're trying to not just geographically isolate from America, we're trying to geographically isolate everyone in Hawaii. So for example, part of the islands like Molokai and Lanai, like I haven't even been there. They're tiny, tiny islands, and there's 0 cases there. There's 0 cases in Molokai and Lanai. So it's part of the reason. We don't want all the sick Hawaiians in Lulu to be like, oh, I'm freaking out. Now I want to go to Molokai and Lanai to ride this out. You won't be welcome there. Those guys are pretty protective as small islanders too. So we need to protect it. So this goes into geographic isolation and low population density. I think it's going to help states like Hawaii and states like North Dakota and South Dakota. Again, no one goes to these states and they don't have big populations. They may not be geographically isolated by borders. You can drive in technically. And one thing I want to, you know, again, America's been getting a lot of crap. Yeah, we had a president, and honestly, we had a CDC that messed up. The biggest thing the CDC messed up on, look this up, they gave tests to hospitals and states that did not work. They were faulty tests. They didn't work at all, okay? So, and they turned down tests from South Korea and Germany. So the CDC is as much to blame for this as Trump in some level, I think, you know? And one thing that our numbers look bad, and yeah, we have so many people, but again, we have 150 million people have to start looking at as a like continent really, and it is in North America in some level, but America, you have to look at it as each state, this is what I meant, as a separate country. Like New York is Italy, right? And Miami and Florida is Spain and Madrid, and like Hawaii is more like Malta or Cyprus, like an island that can protect itself. You have to start looking at as America that way. So the states are going to have different problems, and the governors are going to have different problems and different exposures. And this is geographically and epidemiologically, you have to look at it this way. That's why it's hard to create a national plan, because every state, like New York, needs all the help right now. They are Italy right now, or maybe worse. I hope not worse. I don't think worse, but you never know. So that brings me to my international segment of this and what's going on internationally. Again, Africa still has low, but it's going up. As I mentioned before, South Africa is having higher rates, higher rates of Cape Town. It doesn't surprise me. It's a very popular city to fly to in Africa, of all places. Again, there's a theory that hydroxychloroquine, as malaria users in Africa use it a lot, have protected them. Again, I think the vote's out. Again, they didn't even hit their flu season yet. Only now is Southern Hemisphere, Africa, Australia, New Zealand, all these places hitting their flu season. My friends in Australia are just being told that they can get their flu shot. And again, I think that's in some ways a little bit dangerous, or maybe it's been protective that they didn't have their flu season yet, and it was very hot before. And now maybe they'll get hit, or maybe they prepped really well and they will not get hit. But I'm telling you, I really worry about poor countries. If you've been to South Africa, you've seen those townships, and they're packed together like sardines in metal sheds. Bangladesh, India, you cannot socially isolate in this country. A really interesting quote I heard, again, is that the ability to socially isolate and social distancing and self-isolate is a privilege of basically the 1% or even upper middle class developed nations. A lot of poor third world countries can't do that. There are places in India and tons of people living, like the poor people don't have toilets there, and maybe you're in lower middle class and maybe you have soap and a bathroom, and you've seen the Ganges River, how dirty the Ganges River is, and they wash in that. And again, I'm not just picking on India, but again, India has 1 billion people. And Todd, yeah, as I mentioned last podcast, I'm really worried about India, Bangladesh, the poor cities and countries of Africa that don't have much of a healthcare system. Now, again, Africa has things like the Ebola virus and other things that make them kind of, but again, getting whomped with stuff all at once is going to really hurt them. So I do worry about the poorest countries that don't have a healthcare system where it's really dense. I really worry about India, maybe even Sri Lanka and Bangladesh, and again, those countries. So we do take it for granted a lot. Does heat? It may, but again, we don't. Early evidence is too much, and I wouldn't count on not social distancing just because heat and humidity help. And this is the reason why I don't think heat and humidity could have helped everybody. Because look, again, and for example, the opposite would be that cold is really bad. But for example, Japan was really cold. South Korea was really cold. And, again, they may have protected themselves a lot, but, they don't have many cases. So, you would think they still would have gotten hit really, really hard because it's freezing cold in Korea in February and January, February, and even March, So other bad things. So again, Germany, as I mentioned, people are being tested everywhere, and but they're not testing dead people like Italy, so that may influence why their numbers look better. Spain is the new Italy. 10% or more of their COVID-19 cases are healthcare workers. And in UK, again, they're sheltering in place. They are recommending that people stay home for way longer than, I think, April even. And they are saying that in their best case scenario, 20,000 deaths in Great Britain and the UK would be good for them, as opposed to our 200,000. But again, we have way more people here in America than the UK. Italy, higher mortality rate. They are testing their dead people. So I don't know that every country is doing that. They probably are, but Italy, again, has higher smokers and smaller family circles. I mentioned Mexico. Mexico's another country, and these poor South American countries, Rio de Janeiro, and Brazil. the president or the governor and of Mexico and Brazil, they're being kind of, I'm sorry, they're being idiotic about this too. They are not banning gatherings under 100 people. You've seen the favelas of Rio, how packed they are together. They are like the South American equivalent of the townships. Tremendously about the favelas in Rio and Brazil. The only reason I'm not as worried is that they have their own gang system and a way to regulate and keep people out. But again, if there are a lot of asymptomatic people in the favelas already right now that probably have it, how are you going to stop them? How are you going to test them? You know, so I worry about Brazil and South America a lot. Again, I talk about Bangladesh. I'm not going to go into it. But again, if you wonder how bad it is in Italy, Google India train station, okay, and watch some of those videos and the pictures on YouTube. Or even China train station. But that shows you how much of a good job China was able to do to put into place draconian measures, okay? South Korea is still doing the best. This is how good South Korea is doing. They have walk-in clinic. They have care packages. The government social distancing, self-quarantine to every citizen. Like, it's like a care package from the government to stay at home. I mean, this is how much the government, there's a lot of things I think South Korea has a problem with. You know, gender imbalance, you know, revenge porn. They have a bad problem with that. They have a bad K-pop problem. Everyone loves that. But they are doing a bang job of stopping COVID-19. And I would love for everyone to be like South Korea, but we've passed that. That ship has sailed. But we can learn from them and what they're doing, okay? So, anyway, I'm almost to the end of this. Again, the other countries that are doing well, Taiwan, again, and Taiwan has some of the best rates. And you've seen anyone that's been to Taipei. Taipei is a very packed city with a very packed metro, and they've done well. And again, they've been banned from interacting with the World Health Organization because China politically, again, says they're part of China and they don't want Taiwan to be represented. And that's a shame because we could learn Taiwan, and we're not hearing from Taiwan a lot globally because China's shutting that down. And, you know, that's unfair because Taiwan's done an excellent job along with South Korea. Those are the two countries. If I can move anywhere right now to ride this out, I'd move to South Korea, to Taiwan right now. Especially Taiwan because I have relatives there. I technically have a Taiwanese passport. I'm not going to use it, but, you know, I have one. Anyway, this brings me to now China is reopening business, but it's not going smoothly. Now, as people mentioned, the reinfection rate is coming up. Suddenly from a second, but it's happening and seeing it, and they haven't broadly tested for IgG, IgM also. As they reopen, they're being racist also, or like insidious. There are videos, you can look at the Wuhan video when they opened up Wuhan. Again, that was the epicenter in Hubei, China. When they opened it up to, I think, the Jiangsu province, JIANGXU, they started fighting each other. The Jiangsu people didn't want the Wuhan people to come in. They were overturning cop cars, and, you know, stuff really got real, and they had to bring out the Communist Party leaders to like talk people down. That would be the equivalent of like New Jersey or, you know, Rhode Island or Massachusetts or Pennsylvania, like getting at the highway and, you know, New Yorkers, New Jersey from coming in. This is happening or like people in Austria and Germany banning Italians from coming in later. So that's still happening in China. And China, you know, it is their role now, I think, as a country that honestly messed up because they had cases from November. They prevented speaking out. Their numbers are false. Let's just be clear. Their numbers are false. Their total number of cases, there's no way they only had, you know, 80,000 cases. It's absolute garbage. Their total number of deaths being 4,000, absolute garbage. Don't believe any of those numbers, as I've said in every podcast coming out of China, and we'll never know the true numbers. The only way we'll ever know the true numbers from China if there's a whistleblower from the top ranks of the Communist Party who defects with documents that show the true numbers. And even then, I'm sure China will say this is a hatch and, you know, those numbers are false and they're fake, and they're controlling the media. We will never know. We'll never know how many people were burned and cremated. We will never know how many people were tested or not tested in China. We will never know because China is China. So China owes the world a big debt to make up for this. And honestly, I'm not being racist against this, again, of Chinese descent. This is just the truth. They need to help up. They need to start donating masks for below cost, or sell them for way below cost. They need to help with ventilators. They need to help with, protective equipment. That way, I know they still need to worry about themselves, but they need to help the rest of the world because they've been helped many times. People don't realize how much China has been helped by other countries. So that's the end. Again, this is running really long in the but as I mentioned, I think we need to militarize all the supplies, vents, field hospital, masks, and we're starting to do it to the hot zones, the biggest cities. We need to start doing this in New Orleans. We need to start doing this in Detroit. We need to start doing this in Miami even. And then when it gets bad, other places do that. We need to halt all flights. I think we really need to halt all flights going out of and into the hot zones. I don't think there should be any except only essential flights coming into New York, JFK, LaGuardia, Newark at this point. I mean, that's if I were president, that's what I would do. I mean, that's just common sense. From anywhere else in the country or the world coming or going. And the National Guard is at least on standby, and I think that's a good thing. In Hawaii, again, I think we need to start ticketing more. We need to actually ticket people, $100 or $200 tickets in high pedestrian areas and make examples out of people. I mean, it's not $1,000, but start giving people tickets, giving them real tickets, that way. So again, as I mentioned, I think we have to have inspiration by a lot of us. Probably a lot of you out there got sick and probably have the antibodies. We just don't have the test. The day when we get that IgG, IgM test, and maybe again it exists and will be FDA approved, the Henry Schein test. Again, when you get off, look at this. Henry Schein, S-H-E-I-N. That will be the game changer for us and let us know that we really have been sick or are not sick, or more importantly, have the antibodies. Or are we in the middle of being sick? Or are we in the middle of getting better? And that will help us also focus on who we can test to get antibodies from for disease purposes, for vaccines and treatments maybe, So I think that we're starting to slow the curve potentially, but we still just haven't seen it yet. Because again, the numbers we see today, what do they represent? 14 days ago, 2 weeks ago, or at least 10 days ago, 7 to 10 days ago. So we don't know. This next week coming up, April 1st to April 7th, early April Fools, is going to be the most critical time to look at our active case population adjusted cases growth curve. So the population adjusted growth curve per state, or at least for America, that's the curve I'm going to be staring at this week. That's the one I want to see. Are we starting to hit that hammer, the flattening? Are we starting to hit it yet? Is any state hitting it? Or any states avoided it, like Hawaii and North Dakota, South Dakota. Let's see. So again, as I mentioned on this, and take care of, get out of your head. Obviously, I'm really honored you guys are watching my podcast, but turn off the news and turn off CNN or Fox News if you have to be watching that, or anything after like an hour. It's on a loop. You don't need to focus on it all day long. Try not to be on Facebook all day long. Put your phone away if you're not using it for a movie when you're talking to your kids or your family. Go get the help online. Again, headspace.com is offering, apparently, again, someone tell me if it's wrong because I haven't used for healthcare workers, free therapy and counseling services. Talk to your friends, your family, spend more time with them. I think these are good things. Learn ways. I learned amazing dishes. I'm a really good cook now. I've cooked rack of lamb and my favorite pasta, and I started a side business, and I basically learned my taxes, and I'm learning a lot of things. And I'm going to get back into surfing because we can still do it in Hawaii. When the weather's a little better and when I take care of yourself. So take care of yourself. Take care of yourself, however that means, and take care of your family, whatever that means to make you feel better. So let me answer some last questions. After listening to states are great. Again, we cannot do what China can. We have human rights, and people complain, but we can shut down airports. We can shut down a federal mandate to not let flights go in and out of these things. I think that's a start. You can start with that. I mean, it's hard to really quarantine off a city, but you can give out tickets. You can literally give out $100 tickets on the spot to anybody. that's easy. That's a really easy thing to do. Every state can do that. That's a hot zone. In my mind, any state that has a shelter in place law right now, which is 30 states or 35 states or more, like, should be giving out tickets on the spot to anybody out for not a verified reason, okay? $100 tickets. That's my easy suggestion. That's what every state can do right now. That's what I hope they do. Roe tried to ban New Yorkers, and they can't. You know, they've changed their mind because, yeah, they're knocking in doors. And it's hard because, again, that's our strength is sometimes what sets us apart from China. But unfortunately now, I think it's a little bit of our downfall too, because we have human rights and we have, again, the Bill of Rights and, normal #America thing that people do what they want when they want. Gracie, whatever dinner. Gracie, I'm getting a omakase special takeout from sushi restaurant I'm going to pick up right after this. I'm going to treat myself a little bit. I'm not going to cook today because I've been cooking a lot, and I think I deserve a little bit of that. Yesterday, I had some great poke from Yama's Fish Market, and some leftover Moroccan chicken tagine in the hot pot. I'm doing pretty well. I got to say, for a bachelor, I can cook some pretty dishes. Tomorrow, I'll be making rigatoni alla amatriciana, homemade sauce, some pancetta, and a bunch of good stuff. I make a really good one, man. I would sleep with myself if I made myself this dish, And I can go into that. In airport again, I think again, I think it's not a hot zone. I think it is a hot zone, really real hot zone. I really think they should do that. They should ban flights out of Burbank and LAX and Ontario and John Wayne. Who has to fly anywhere? Is job right now that you really have to fly somewhere. I mean, everything should be on hold. If people are losing their jobs over stuff, I mean, I know it sucks, but I'm not talking about shutting down the airports for months. I'm talking about shutting down the airports for 2 weeks again. Start with 2 weeks of shutting down that airport. Then if it's not working, then you shut it down for a 3rd week or a 4th week, but shut it down for 2 weeks. I mean, other people saying shut it down for 5 or 6 weeks. My point is, 5 or 6 weeks shut down for America because no one in America can even do stuff for 1 day, right? People are not capable of doing this. We are seeing the best of humanity and the worst of humanity right now. And look at your friends. Look at your friends who are posting up selfish things and like not dealing with stuff well, and either help them through it or make a mental note of who you don't want on your zombie survival team. Like, we're seeing the best of donations and people giving of themselves, and we're seeing the worst of society and humanity right now. And this is a very sobering lesson to learn. I think they need to put a curfew in. To get grace, how do you enforce this curfew? I think the easier way, you can say the curfew, but the way you do it, you just start giving tickets out. You start giving tickets out if they don't have a legitimate reason. And how do you prove that you have a legitimate reason? Then, you say you're an essential worker going somewhere. You could say, I'm going to buy groceries. Or you can say, I'm going to the pharmacy. And that better be true. And maybe they'll follow you there. I mean, like, it's hard to put a curfew in because a curfew means you're going to keep track of every single citizen that way. And there are honestly not enough cops to walk around Waikiki on a normal day, So that's why it's hard to put in a curfew. Again, human rights, putting in a curfew for a place like New York City is almost impossible, So that's it. Oh, Steph, I'm really sorry, friend. I hope they get better. If you want private, message me later about what's going on. Yeah. So he's lost his sense of smell. It sounds like they're doing better. I think he lost his sense of smell, but again, he's been waking 12 days. And maybe we have 6 weeks now, but we can't do it. And I know, again, Bill Ackman was one of the first people who made $2.1 billion betting against the market very early that this is going to happen. And he wants to shut it down too for 4, 5, 6 weeks. In America, I don't think it's realistic to do that because people are incapable of doing it without being enforced. People just can't do it. They can't stay home for 1 day, so it's hard. Lara, the homeless are out. It's hard. Homeless, I feel bad for. I really feel bad for homeless, Lara. And I don't know it's a big problem. They're going to get sick, and some of them have a lot of diseases. But, you can try to put that in place, but you have to focus. I would almost say let the homeless run around a little bit for a while. And if they get sick, then you bring them in. And if you screen them and they're say, or treat them, that way. You need to start screening homeless a little bit some way, maybe not ticketing them because they don't have any money. So maybe there should be a compassion exception for homeless. Um, uh, uh, yeah, there are a lot of 1170 for Orlando. Grace, how are they enforcing that curfew? That's what I want to know. Once you put a curfew in place, I would love to lock it down every single state for 6 weeks in every, or every country for 6 weeks. But how do you enforce that? Are people patrolling? Is it neighborhood watch? Or are you going to run into a George Zimmerman, stand your ground stuff where we have vigilantes going out with slingshots and guns? And I mean, we can narc each other out. I think that's good to do. If you see someone throwing a massive party in their backyard, and besides the noise stuff, narc them out, put them on blast, video them, and blow, put it on blast on social media and Facebook and all your COVID groups, especially your local groups, which I'm sure a lot of you are on local COVID groups like I am. Put it on blast, call 911. Well, don't call 911 because it should be safe for emergencies, but let someone know. I think that's important. We need to start narking each other out. We need to start. You need to be like the person that sees someone had a zombie bite in a zombie camp, in your camp. You need to be like that person. Narc them out, narc them out. I fully enforce narking people out that are not participating with the law, especially if they're flagrantly. For example, in Hawaii, they have hostels that are hostels. Like, again, so we'll see what happens there. And, yeah, say something. That'd be a great thing. See something, say something. So that's it. I'll leave it at that. We're at 90 now. I'm probably going in news, and then longer podcasts on Monday and Thursday. If something really massively happens, I'll let you know and do a podcast on like a Wednesday or Saturday or something like that. But I'm going to try to stick with Monday, Thursdays from now. So again, I am the Traveling Doctor. This is a public podcast. You can share it to anybody. I am putting them on YouTube. And again, you can share it just for my friends. I'm going to make it clear now. Again, you can add me at the Traveling Dr. On Twitter and Facebook.com/the Traveling Dr. Page there. Instagram is at the Traveling_MD, and YouTube, my link is up there. You can just search for the Traveling Doctor on YouTube, Twitter, Instagram, or Facebook, and I should be the one that comes up. Traveling with one L. Again, they spell it with two L's, by the way, in Europe, and both ways are right. So anyway, that's it. Stay safe, guys. Again, keep that social distancing. Wash your damn hands. Do not hoard. Donate stuff if you can, if someone needs it. And we've got this, guys. Just, 2 weeks have gone by, essentially. Or maybe 10 days or 7 days for some people. So it's not that bad. We can do this. So keep an eye on those curves, and we'll see how we do this week. I have hope for us all, okay? Again, this is Aloha. This is Aloha. This is the Traveling Doctor saying aloha. Thanks for joining in. Feel free to like